Welcome to the deep dive. Today, we're getting into something pretty common, multivitamins.
Yeah, loads of people take them. About 1 in 3 adults in the US, right?
Exactly. And there's this, general feeling they boost health, fill in the gaps in our diet.
Prevent diseases, maybe?
Right. But we're going to look at what the science actually says.
It's a really appealing idea, isn't it? Like that JAMA editorial mentioned, just grabbing all the nutrients from fruits and veggies and boom, putting them in a pill.
Uh-huh. Skipping the hard work of eating well.
Kind of.
And we know you, our listener, want the real story, fast but thorough. So our mission today is to figure out if these pills truly help most people.
Yep. We've looked at quite a bit studies, these big meta-analyses.
Which combine results from lots of studies gives a clearer picture.
Exactly. And, what experts are saying.
Okay, so let's jump in. What do people think multivitamins do versus, well, the reality?
Well, people take them for all sorts of reasons, like increasing nutrient intake, making sure they get enough.
Covering the bases?
Right. Improving health, maybe preventing sickness. There was that survey showing a huge 92% of users think they're essential.
Wow, 92%. That's a
Yeah.
lot of faith in them. It's like nutritional insurance.
Mm-hmm. It feels good, right?
Yeah.
But then you look at the big picture evidence.
Like the U.S. Preventative Services Task Force, they did that massive review, didn't they?
Yeah, 84 studies. And their conclusion was pretty blunt.
Which by
Basically, little or no benefit for preventing cancer or heart disease or even death for the average person.
little or no benefit. Okay.
And interestingly, they actually found a potential harm in some cases, like beta-carotene supplements increasing lung cancer risk in smokers.
So not only maybe not helpful, but potentially risky for certain groups.
Exactly. It really pushes back against that just-in-case thinking for everybody.
Dr. Jenny Gia, who co-authored that JAMA piece, she also stressed this point, right? About the lack of strong proof.
She did. She emphasized there's just no clear evidence that these pills prevent chronic stuff like heart disease or diabetes.
Unlike actual food.
Right. Unlike eating plenty of fruits and vegetables, where the benefits are really well established, it's just not the same.
Okay, but Dr. Gia also pointed out some limitations in the research itself, didn't she?
Yeah, that's a really important nuance. Often, the folks in these studies, they're already pretty health conscious.
Ah, right. The ones already eating salads and hitting the gym.
Exactly. So it's hard to know if the result would be the same for people with, say, poorer diets or less healthy lifestyles to start with.
So there's a gap in understanding the effect on a maybe more typical population.
Potentially, yeah. We just don't have clear data on that right now.
Okay. So for the general population, the broad claims seem a bit shaky based on current evidence. What if we look at specific conditions? Let's start with heart disease. I hear the evidence there is kind of all over the place.
That's a fair way to put it. It's definitely mixed. You've got some studies hinting at a lower risk of heart attacks or death with multivitamins.
Okay, so some positive signals.
But then you have major studies, like the Physicians' Health Study to Ever, that was thousands of male doctors followed for over a decade. No difference, no reduction in heart attacks, strokes, nothing for mortality either.
So conflicting results.
But then, adding to the confusion, a newer study did find a link in women who took multivitamins long-term, like over 3 years, with a lower risk of dying from heart disease.
So maybe it depends on how long you take them. Or perhaps gender plays a role.
Could be. It's not a clear yes or no. Definitely not for everyone.
Okay, let's switch gears to cancer, another big one people worry about. What's the story there? Still mixed.
Very much so. Again, some studies show no effect or even hints of increased risk in certain situations.
Right.
But then other research points differently. Like one review combining 5 big trials, these randomized ones, which are generally stronger. It found men taking multivitamins had a 31% lower risk of cancer overall. But interestingly, no similar benefit was seen in women.
31% lower in men.
Oh,
That seems significant.
It does. And the Physicians' Health Study, too, also found men taking multivitamins long-term had a bit less cancer overall. Plus, some studies link long-term use to less colon cancer specifically.
So some potential benefit, maybe particularly for men, maybe for certain cancers.
Possibly. But you also have to weigh that against other findings, like that Swedish study suggesting a slightly higher breast cancer risk in women taking multivitamins.
It's really complex, isn't it? Not a simple answer.
Not at all. It really highlights how much we still need to learn about specific contexts.
Okay, what about keeping our brains sharp? Any evidence for multivitamins helping with cognitive function?
There's some research there, yeah. Some smaller studies hinted at memory benefits in older adults. And, generally some links between nutrient supplements and maybe easing anxiety or depression symptoms.
Okay.
But more recently, these Cosmos studies, Mind, Web, Clinic, they've actually shown some pretty interesting results, suggesting that daily multivitamin use might actually improve thinking skills, memory, and planning abilities, executive function in older adults, especially those who've had heart issues before.
That sounds promising, especially for older folks.
It is. But again, got to keep perspective. Other studies haven't found much difference in mood, so maybe some cognitive benefits, particularly later in life, but it's not a guaranteed thing for everyone.
Right. And finally, eye health. I know there's some specific research there.
Yes, the ARE studies, age-related eye disease study, really important work.
What did they find?
They found that a specific cocktail of high-dose antioxidants and minerals, C, E, beta-carotene, zinc, copper, could actually slow down the progression of age-related macular degeneration, AMD.
Slow it down. That's significant.
Yeah, and maybe even lower the risk of cataracts. The follow-up study, AREDs2, tweaked the formula a bit, suggesting beta-carotene might not be needed, and looked at adding things like lutein.
So for specific eye conditions, like AMD, certain supplements have shown real, measurable benefits.
Exactly. That's a case where targeted supplementation, based on evidence, makes sense for people at risk.
Okay, so it seems the takeaway isn't never take multivitamins, but more like they aren't a universal fix, but they might be important for specific people or situations.
Precisely. That's where the conversation should really shift.
So when is a multivitamin actually recommended or needed?
Well, clearest case is pregnancy, or even planning for pregnancy.
Right, prenatal vitamins.
Absolutely.
Right.
The American College of Obstetricians and Gynecologists is very clear on this. Taking a prenatal multivitamin is crucial.
And the key ingredient there is?
Folic acid. It dramatically reduces the risk of neural tube defects like spina bifida in the baby. That's really solid evidence, a strong recommendation.
Okay, that's a definite yes. What other groups might genuinely benefit?
Well, older adults can be another group. They sometimes have trouble absorbing vitamin B12 from food,
Ah, yeah, I've heard that.
and they might also need more calcium and vitamin D for bone health.
Makes sense. Anyone else?
Vegans and vegetarians definitely need to pay attention. Their diets can be lower in certain nutrients, primarily found in animal products.
Like B12.
B12 is a big one, yes,
Mhm.
but also potentially calcium, zinc, iron, vitamin D, maybe omega-3s. Supplementation might be really helpful there.
Okay.
And the NIH also points to people with really poor overall diets, those on super low calorie plans, or people who've had weight loss surgery. They might just not be getting enough essentials.
So it's really about targeting specific known nutritional gaps or needs.
Exactly. It's not a scattergun approach. It's addressing identified risks or deficiencies.
Got it. Now, we touched on a potential risk with beta-carotene earlier. Are there other downsides or cautions people should know about? Can you take too much?
Oh, absolutely. More isn't always better. Getting excessive doses of certain vitamins and minerals can definitely be harmful.
How does that work?
Well, you've got water-soluble vitamins like C and the B vitamins. Your body can usually flush out excess amounts of those. But then you have the fat-soluble ones, A, D, E, and K. These can build up in your body's fat tissues.
And become toxic.
Potentially, yes, at very high levels over time.
Are there specific examples people should be really aware of?
Well, we mentioned pregnant women needing to be cautious with vitamin A too much is linked to birth defects.
Right.
And the beta-carotene and lung cancer risk in smokers is another major one based on those Finnish and carrot studies.
Okay. What about minerals?
High doses of iron, for instance, can cause stomach problems, constipation, and sometimes, though hopefully rarely, there can be issues with manufacturing pills containing way more or less than the label says.
That's concerning. So if someone does choose to take a multivitamin, maybe because they fall into one of those specific groups, how can they be safer about it?
Dr. Lichtenstein had some good practical tips. One was to look for a product that provides roughly 100% of the recommended dietary allowance, the RDA, for most nutrients, not mega doses.
Don't go overboard.
Exactly. And also look for third-party certification seals on the label, like USP is a common one.
What does that mean?
It means an independent organization has tested the product to verify that it actually contains what the label says it does in the stated amounts and doesn't have harmful contaminants. It's a layer of quality control.
That's really useful advice. Okay, let's pull back again for the big picture.
Mm-hmm.
The overarching message seems to be, pills can't replace plates, right?
That's a great way to put it. Dr. Lichtenstein really drove this home. Multivitamins just don't have all the other beneficial stuff found in whole foods.
Like fiber.
Fiber, yes, but also thousands of these phytochemicals, plant compounds that have all sorts of health effects we're still figuring out. You just don't get that complex synergy from a pill.
And the big health organizations like the American Heart Association, their advice focuses on diet and lifestyle, not supplements, for preventing disease.
Absolutely. Their 2021 guidelines are all about food patterns. Fruits, veggies, whole grains, healthy proteins, limiting processed stuff, sugar, salt. That's where the strong evidence for preventing heart disease lies.
Not in a multivitamin bottle.
Not according to the current weight of evidence, no.
And Dr. Gia's point about lifestyle.
Right. She stressed that the things we know work for preventing heart disease are evidence-based lifestyle choices. Don't smoke, moderate alcohol, healthy weight, exercise, healthy diet. The support for those is way stronger than for multivitamins.
It sounds like the Johns Hopkins editorial summed it up pretty bluntly, too.
Yeah, they basically concluded multivitamins don't cut risk for heart disease, cancer, cognitive decline, or early death, and maybe you'd be better off spending that money on actual healthy food.
Okay, so wrapping this all up. For you, our listener, trying to make sense of this, what's the main takeaway from our deep dive today?
I think the key thing is multivitamins are super popular, yes, but the science right now doesn't really back them up for preventing major diseases in the general population.
The focus should really be,
On your diet first. Getting your nutrients from a balanced, varied diet rich in whole foods. That's what the dietary guidelines for Americans recommend as the foundation.
but for certain people,
Yes, for specific groups planning pregnancy, pregnant women, maybe older adults, vegans, people with absorption issues, or very poor diets, supplements can be necessary and helpful. But that's ideally a conversation to have with your doctor or a healthcare provider.
right, get personalized advice if you think you're in one of those categories.
Exactly.
So maybe a final thought for you, listening. Take a moment to consider why you might be taking a multivitamin or thinking about it. After hearing all this, could focusing your energy on improving your eating habits, step by step, be a more powerful way to invest in your long-term health? What's one small dietary change you could make?
That's really the core question.
That's our deep dive for this week. Thanks for tuning in.